Question is that the motion be agreed to. I call the member for Fisher.
Thanks, Madam Deputy Speaker. Regional communities like mine are in a healthcare crisis, and Australians have had a gutful of this Labor government's cuts and clumsy mismanagement of the healthcare sector. Over a quarter of the Australian population lives in regional, rural or remote Australia, and nearly a quarter of those Australians are over 65 years of age, when we all know that people require more health care. They are more likely to need access to acute, critical and or long-term health care, as well as aged care, disability and practical support. Despite this demand on their services, communities like mine have a dire shortage of general practitioners and primary health care workers. High turnover, skyrocketing costs and poor infrastructure and connectivity means that GPs can't afford to practice, they can't afford to set up a clinic or keep their doors open. And we know this all too well in Fisher. Madam Deputy Speaker, I cannot tell you the number of emails and phone calls that I've received from GPs that are screaming out for help, that are screaming out for more doctors because they are overworked and, quite frankly, they are at the end of their tether. Since my election in 2016, I've stood shoulder to shoulder with the Fisher community in the fight for better healthcare infrastructure. I fought for mental health care services, and I remain committed to establishing the Sunshine Coast as a mental health care hub. To that end, I've delivered $4 million to set up a headspace in Caloundra, which is now 18 months long overdue, and but for the continued hassling and pressuring of this government, they're only just now starting to open or talk about opening next month, which is going to be 18 months late. I've secured $8.3 million to establish the National PTSD Centre in Batinia, Australia's first PTSD research centre. I've secured $11.4 million to set up and fund youth mental health and suicide prevention work through the University of the Sunshine Coast Thompson Institute, alongside Roy and Nola Thompson. I've secured $7.3 million to set up and operate Australia's first residential eating disorder facility at Wandi Nerida. And I've also secured funding for eating disorder recovery coaches, youth mental health events, men's sheds, veterans' wellbeing and psychosocial care. And now in opposition, I'm fighting for Fisher families to access the health care services we need. I spoke up for the community of Montville, who desperately needed a doctor. Hundreds of hinterland locals signed my Montville Needs a Doctor petition, calling for the government to reconsider the funding model they apply to GP funding. Our petition and requests fell on deaf ears of this Labor government. We stood up to Labor's reckless attack on community pharmacies. Labor's botched changes to dispensing, discounting arrangements and reckless red tape pushed community pharmacies to the brink. In Fisher, the uncertainty and skyrocketing costs drove some doors to close. As the Shadow Assistant Minister and member for Mallee said so well when she said, Labor's scorched earth approach to regional Australia has left some regional towns with their pharmacist as their sole primary healthcare provider. That is, if they still have a pharmacy. Thankfully, alongside community pharmacies, the Coalition fought to negotiate a new 8th community pharmacy agreement with the government. But as always, the Coalition has a plan to remedy Labor's regional health crisis. We will invest $400 million to incentivise and equip the next generation of GPs for regional communities. We'll slash the red tape and cut the taxes which are crippling healthcare providers. We'll restore the telehealth system which Labor has sought to dismantle. And we will once again double the number of psychologist visits available under Medicare. That was one of the first things this health minister did, was dismantle the number of visits that a person could go and see a psychologist. That was this Labor government that cut the funding for people who are at their most vulnerable, people who need to go and see a psychologist. The health minister cut that funding shamefully, disgracefully. That meant that tens of, if not hundreds of thousands of Australians could not access appropriate psychologist visits, and we will fix that when we win government, God willing, and if the Australian community support us next year. Authorised by Andrew Wallace, LNP, Boccarina, Queensland.